So, hey, everybody, welcome back to another episode of Physical Therapy Private Practice Secrets of the Top 10%. I am super excited about this week's podcast. I have Garrett and Jason with me, and I'm going to let those guys introduce themselves. We are going to be talking about technology. We have technology on the brain here. As you all know, things are changing, and they're changing pretty quick out there. And so we need to combat that, whether it be Medicare changes, the supply chain shortage of people changes, the great resignation, you could name it. Just go ahead and turn on the news and pick your enemy. We need to be at cause. We need to be in the driver's seat of bringing about change. As you've heard me say in the recent weeks, I am not interested in thinking outside the box. I am interested in getting rid of the box entirely. We have got to step out and start creating a new paradigm for physical therapy. And we're going to talk a little bit about that. I will give you a little housekeeping things. Please, for those of you who are on the fence, jump over the fence and get to PPS in Colorado. We've got 2 lectures there. There are the industry leaders, the forefront thinkers of our profession there that you can actually meet. I would be happy to introduce you to anybody I possibly can that is going to help you live the life of practice ownership that you've always deserved for yourself, or anything that I can do to help the profession of physical therapy become a bigger and stronger profession. That's why I do these podcasts. That's why if you're watching us on YouTube right now, that's what I should be watching the camera while I'm talking to you. If that's the case, that's why we do what we do, is to help advance the profession of physical therapy and help you live a better life as a therapist and practice owner as well. I mean, it's all about the patient care experience, right? None of us who have a PT license or degree think that we go to work trying to sell our patients anything. We go to work every single day trying to achieve optimum health with each and every engagement we have. To that end, it was about 3.5, maybe 4 years ago when I was first introduced to the Neubie. And I was like, yeah, blah, blah, pow, pow. I get introduced to all kinds of new equipment, fancy techniques, and new things that everyone's trying to sell you, or they want to get to my public or meet my people or whatnot. And I kind of took it like that a little bit until I saw how it was being used. And it was the first time in my life that I actually saw somebody getting an active, resistive strengthening program while connected to it's not like Russian stem where you're sitting there and you're doing long arc quads, right? This was like a full rehab program being implemented while having this electrical device connected to your body and performing at a level that I had never witnessed in my life. Now, at that time, many of you guys know, I have since had back surgery. I've got a new disc in my back. I am like so much better. My whole life has changed. But at that time, I was in the early stages of my injury, and I was at Jason's office. We were looking at doing some stuff together with his office. And I said, hey, do you mind hooking me up and let me experience that for myself? I have this radiculopathy. And he's like, yeah, what is it like? I'm like, yeah, it's like a 5.6. He's like, you're like on a 5.6. I'm like, yeah, I have this pain down my leg like all the time, and I'm just trying to get through the day. He threw me on that thing, and I did maybe 15 minutes, maybe 20, not even. And I'm driving home and I'm calling my wife on the cell phone. I'm like, the leg pain is gone. I don't even know what just happened right now. I just did this thing. And she's like, well, probably back by the time you get home. It was gone for like 3 days, 4 days. Immediately I got on a schedule and got more treatments. And I was good for such a long while after that. I referred multiple friends and people that I work with over to Jason. And that was the beginning. That was honestly the beginning of the Neubie. And the funny thing is, it wasn't like Jason's like, hey, Brian, you're here in my office. You got to check this thing out. Or, hey, I'm involved in this thing. There was none of that. And we just kind of stumbled on it together. And he told me about Garrett, the founder, the wizard behind curtain number 3 in Oz, who figured out how this all works and comes together and built it. And I was like, just, wow, one person did that. I mean, he's not like Bill Gates' kid or anything. I mean, there's nothing new under the sun in physical therapy these days. And that's the story, everybody. So that's the early beginnings for me. And I've been a huge advocate. I'm a big sponsor of the Neubie and Neufit and everything that they bring to bear. I was just telling Jason and Garrett how glad I am that we're all on the same bus to help this profession of physical therapy and help as many patients as possible. I've got more stories to tell, but I am going to stop talking right now, because what I want you guys to hear is I want you to hear from the originators, Jason, the original guy, physical therapist office, who brought this to extremely high level of success within the PT community. And of course, Garrett, the founder. And I'm going to let Garrett introduce himself by telling the story, Garrett, of what brought you to the point of even thinking about creating a new device such as this. And it may not even been your physical therapy was even in your forefront of your mind at that time, because of course things have evolved. But I think people would love to hear your early beginnings and like, how did you even come about this?
Absolutely. Thank you so much for having us on here, Brian, and happy to share that. So the initial catalyst for me is actually an experience I had back when I was in college. I played Division III ice hockey in New England, and I was passionate about the human body. I was an athlete. I was looking for an edge and interested in training and everything, but I was also frustrated with traditional physical therapy and traditional orthopedic medicine because of the experiences I had. And, I was in my late teens, early 20s, and for multiple things, I was told to rely on taking anti-inflammatory oral NSAIDs or anti-inflammatory injections and braces, wear braces for different parts of my body. And just like the overall solutions being offered to me didn't seem all that exciting. And I was in PT mills and, the quality of care, all the stuff I've learned about now, having interacted with the industry a lot more. But so I had this experience where I had an injury. I was supposed to be out for 3 months to have surgery to repair torn ligaments. And I ended up working with a doctor who was doing functional neurology and was using older versions of direct current. And direct current, had fallen out of favor for decades, but this guy was using a version of that. And those two things made a big difference for me. The functional neurology, looking at the neurological response to injury and trauma, the guarding, protection, inhibition, apprehension of movement, hypersensitivity associated with chronic pain, working with those principles and dealing with that neurological response helped set my body up for healing. And then using this older direct current created this electric field gradient that optimizes and accelerates the healing process. Long story short, my ligaments in my wrist healed in 2.5 weeks. I avoided surgery altogether. And it was just this amazing moment for me where when I was in school, I was a physics major. I was pre-engineering, set to go to engineering graduate school. And to find something that made sense to me from first principles made a huge difference. And so I just felt called to share this work with as many people as I could. And that launched me on my journey. One funny story about that is after I had that experience, I found some older DC device and I started treating teammates in my dorm room after practice late at night and stuff like that. So I feel fortunate to have found something I was so passionate about at a really young age. And then I started using those older generic DC devices for several years in Austin, Texas, where we are now, where I came for grad school, working out of the practice of the guy who was the chiropractor for the UT Longhorns football team, out of his private practice in a 150 square foot room, started building. And through that time, I just kept seeing opportunities to make the technology better, I wanted it to be able to do more things and was waiting for someone else to do it until finally I decided, you know what, I got to do it myself. That was what kind of inspired the Neubie, and I'm grateful now to be able to work with therapists like you and see the impact it's making in the physical therapy community, including with Jason. So one of the early, once we finally launched the device after a couple of years of development work, I got connected with Jason through a mutual friend, and I'll segue it over to him now to let him tell his story. But he was the first PT clinic to start using it. Had some really good success, and we've been able to collaborate from the very beginning.
Yeah, let me ask you though. So from the moment that you were first introduced, I'm just thinking of my audience wanting to know some of the few more details. From the time that you were first introduced to it for your wrist injury to the time that you finally put down the pen and said, no one else is going to improve this, I'm going to do it. How much experience, how much time had lapsed from that period?
Let's see, probably 8 to 9 years.
So 8 to 9 years
10, maybe 10, 9 to 10 years.
9 to 10. So you had 9 to 10 years of experience in this sector of DC current and its reaction. So you had plenty of time. See, I didn't know that, everybody. I'm asking these questions for myself as well. I'm not asking rhetorical questions now. So you had that amount of time to actually evaluate what was favorable, good, advantageous, and what was holding it back? What was the shortcomings and limitations, correct?
That's right. Yeah.
So because of that investment of that 9 to 10 years, that's what really probably, I don't want to lead you here, but is that what gave you the confidence to say, this is going to be worth the next 2 to 3 years of my life to develop a better widget, because you knew what it could do that it's not able to do in its current state and form?
Yeah, absolutely. So I was, the tech guy working out of a back corner of this office and was getting really good outcomes. I not not being a clinician, collaborating with other people and everything. I was only able to do so much, but I would see people recovering faster. I saw some situations like mine where people were avoiding surgeries. I saw some situations where people were getting out of chronic pain that they had had for weeks or months or years. And every time I had one of those types of experiences, that motivated me to want to share this with even more people, kind of just strengthen that internal sense of that calling or that internal drive to share this with more people. So I also saw some challenges, some people we couldn't help, some things that I wished we could do better, some things that I wish the technology could do better. And so it is a case of standing on the shoulders of giants, right? This didn't just come out of thin air. It's a meaningful improvement on what was out there already. There's a rich history in electrical stimulation. But yeah, that experience, I feel very fortunate to have gotten in my 10,000 hours, at a relatively young age, and to be able to get to understand this technology so that I could lead the process, because we had to get more sophisticated electrical engineers involved and other product development people involved. And so to have that very solid vision and desire to know what I wanted, but then also to be able to communicate that to the people who would develop it and do that work. I think it's that definitely played an influence, and it gave me the conviction to get through, because it was a longer, more expensive, more challenging process than I knew when I set out. So I'm grateful that I had that conviction to get through it.
I always
Still
say,
is, right, Garrett? We have conversations every day about that.
Yeah. Oh, I bet. And the public doesn't really understand the estimation of effort that goes into because everyone likes to look at the finished product, and I definitely wanted to ask that question because I lived a similar journey with developing Meg's learning management system, right? Meg Academy. For a few years there, I was a consultant, quote unquote consultant, and flying all over the country, going to the Marriott, booking the rooms, training everybody, giving them a binder, doing what they're doing, but only to see that only 37% of the people were truly reaching their goals and living their ideal scene. And it was, I had the same epiphany you had. I had the same reaction. I'm like, okay, so if I want to continue doing this and flying around the country, going to Houston, Dallas, New York, San Diego, and they're paying me $5,000 a day to do these talks and do these lectures, which is good money by, I'm being just transparent. And if you're interested in sales, you would just keep doing that, right? Just keep making the money, just do it. But I wasn't. I've never been interested in sales. That's never been my motivation. My motivation was how many people am I helping and how much better can I help them? When I saw only 37% of the people succeeding, I was like, you have to do this better. I've been down on consultants for a long time. And I think a lot of them probably don't like this message or care when I say this, but I think consulting is dead. I think if you're any kind of an athlete, you understand that a coach is there to enable you to perform at a higher level than you would otherwise do yourself. And so as a coach, having a coaching academy, and that's what we do on a web-based level, I'm bringing you this podcast with Garrett and Jason and Neubie because it's going to allow you to perform at a higher level. You're going to practice at a higher level. You're going to create a higher level business. And I want every therapist to operate at the top 10% of their license. So I want to kick this over to Jason, who literally took this from Garrett, not with force, but out of a gesture of gifting, and brought it to the PT community, I think, in the most, extravagant, large way. I'm not saying that properly, but in the biggest way possible, because now there's literally hundreds, if not thousands of therapists using this every single day. Jason, share with people, like I asked Garrett, how did you find out about this? I heard it was from a friend of a friend. And then how did you sequentially put this into your practice? And at what point did you know you were on something that was going to be, like I said, a paradigm shift, out of the box operation for physical therapists?
Well, the first time you and I met and I told you about the Neubie, and we were in the middle of a quiet restaurant, and I told you about how well it's been working and how I think it's going to change the field of physical therapy, you stood up at lunchtime in the middle of a really nice, fancy restaurant in Tampa, and you stood up and you said, "Holy expletive, now we're on to something." I looked around like, whoa, what's going on here? And I'm assuming you don't do that with the first interview with all of your potential clients, but that's but that's what you did. I was like, huh. And going back to when you said that was probably 2 weeks before I treated, you're like, okay, smart guy, let's see how well it works. This is what I'm thinking. You're thinking in your mind, right?
Yeah.
Okay, all-star PT, let's test it out. And when that first time you came in, I think as PTs, we all get a little bit nervous when we have somebody with, like, I guess, some celebrity status, and not to kind of put you on a pedestal saying, but like, I knew like you had a big following. I knew you're a PT. And even if I just treat another PT and they tell me they're a PT before I treat them, I'm like, oh crap, are they going to think my technique is good? You're thinking all these things, right? Or is it just
I think the same thing. I think all of us do that.
Are they going to think I'm not that smart?
Yeah.
Are they going to be a much better manual therapist than me? Yeah. But with the Neubie, you just go through the process. And Garrett told me this a long time ago. If you just trust the process, what they call the Neufit method, you're going to get like a 10x multiplier of what you already know your skill set is. And let me backtrack a little bit. I've been waiting for this conversation with the two of you, and myself being gifted a spot on this panel because, with the mentor, my mentor in Brian Gallagher, the inventor in Garrett, and me, kind of the boots on the ground guy that just somehow stumbled upon trying to, find proof of concept. If it wasn't for like the harder I look, the luckier I get with the Neubie, I don't think I would become known. What I think some people know me now is like the tech physical therapist, or the guy who can bring something that's virtually not known that well and show how it can work in a physical therapy business. So that in a nutshell is who I am. I'm a physical therapist first, practice owner. And now I don't know what I would be called in this conversation.
Well, I want to stop you right there and just let the audience know, like, look, this is 2022 going into 2023. Jason has cornered the market of physical therapy, new technologies. He knows how to bring them to you. He knows how to educate you and your staff on them. He knows the sequential rollout, the strategic approach, the marketability. So look, you guys hear me saying this all the time. You have to be the zebra in the pack of horses today. You have to be the differentiator. You have to be the market disruptor. So those of you guys listening, you want to learn more about that, you're going to have it all in the comments below, all the links and all of our stuff. But that is what Jason is bringing to market. And of course, this just made sense that this would align with your interest of technology and PT environment. So I want to label that, if you don't mind me branding you as such, because that's what I tell people. That's why I want them to reach out to you. Neubie is fantastic, but you have more than an arsenal of opportunities for people to grow and become a differentiator using different technologies. And we'll talk about that a little bit later.
Yeah. And I think it's important for people to know it's not just on a whim where you go grab at a bunch of different things and see what people will buy or what people have an affinity to. First and foremost, the product just has to work. And I've tried to get ways that the Neubie doesn't work. And when you're asked, like, what isn't it good on? I name the 3 contraindications because it just works, right? And if it doesn't just work, it's not going to work in any PT practice. It doesn't matter how much it costs. It doesn't matter any of this. Second thing is it's got to be easy to bring on board, and your therapist can't be afraid of it. And third, which is what I've worked with Neufit to try to kind of perfect that message. And third is you have to be able to utilize it across the majority of your patients easily and effectively, right? And the Neubie does all that. Some of the other systems and technology that we've kind of brought to market, like HRV, is important. But to go back to your very first question, I was first introduced to the Neubie and to Garrett through a guy that's pretty well known named Ben Pekulski. He was a bodybuilder at the highest level, and now he's a coach and a mentor and a guy who just wants to kind of improve people's bodies and things like that. But he saw it, when it was just getting FDA cleared at I think it was a bodybuilding conference, and then he told me, gave me Garrett's number. And at the time, this was at the end of 2017, beginning of 2018, around the same time you and I met, Brian.
Yep.
And it was kind of like a perfect storm. And I don't know if we have time for Garrett to kind of share his perspective of the first time we talked. Garrett answered the phone when I called. It was his business. But he tells the story a little bit to the potential clinicians that want to adopt new technology. Because I went into his training center. He had 10 newbies lined up, and we were there for training. And there were people coming in and out, like 10 an hour, all cash based. That Garrett talks about it. An all cash based, like performance training facility, bringing in 7 figures a year focused on this one piece of technology. And I'm thinking, man, wouldn't it be great for PTs to have the mindset of, let me just bring in $100,000 a year in cash-based services as a PT, as the expert in movement science. But I don't know if we have time for you to just share a quick, 5-minute thing. Don't tell them I didn't know what a Golgi tendon organ was in that first.
Go ahead, Garrett.
Yeah, absolutely. So it was, I think you were in our first or second training that we did. And I think part of the special sauce here is that we're finding ways to apply this functional neurology paradigm into physical therapy, not being as focused on, enamored with the hardware and tissue of the body, looking more at function, the neurological response to injury and trauma and all that. So we do, when Jason mentions, we were joking about him forgetting what a Golgi tendon organ was, because we start the course by talking about some of the foundational neurological concepts and principles, like how our brain's number one priority is survival and protection. And because of that, it often tries to get our bodies to do less and not more, and it limits us. And that's part of why it takes so long to recover from injuries, and why we use the Neubie in the mapping process to scan around on the body, identify where those neurological issues are. So we're going through all that, and we were teasing him, about all the little things he forgot from PT school. But during that weekend, he saw people coming through there, and just I think felt really inspired to try to bring a model like that into his PT clinic. And so we ended up having lunch together during the third day, and he told me that he was fired up about it, and I told him I was, of course, enthusiastic to work with him, and that we'd watch very closely and support him as much as we could in implementing this, and just really try to stay in close contact and see how things were going. And very quickly, the results were positive. And I think that's, he can tell you, but from my impression, it's, using the Neubie there, and the difference it made in his practice was a big part of what allowed him now to get out of the day-to-day of treating, have more time to lead the strategy, not only of his clinic, but now take on this new role that you're describing of the consulting with other practice owners and supporting them in onboarding technology and kind of this next iteration of his career.
For the record, I didn't forget Golgi tendon organ. I didn't want to mix up muscle spindle and Golgi tendon organ. I've been out of school for 20 years, so I've relearned a lot about physics since then. So if you're training with me, don't forget that piece. Erase this part of the interview.
Rachel will edit that out. You're good. So Jason, you got introduced. How long from that point when you went to the course, how long did it take for you to buy your first machine, and how did that rollout go?
Yeah, I was one of 2 PTs at the course, and literally it was like, I exaggerate for my own benefit, but I literally think your place was like 800 square feet. That's how I picture it, Garrett. And I was one of 2 PTs and 20 people getting trained. Nobody else was a PT. That's why he called on me about the Golgi tendon organ. And everybody else was either exercise science, entrepreneurs, biohackers. So I brought it back, right then, and had my first machine. And I just learned how to use it. I learned about the physics, which Neufit has their, intro course, which was called their foundation course. And I told my staff that this has real potential to help really change the way we practice physical therapy based on the little bit that I knew about it and previous experience with direct current a little bit ahead of that. And my only, instruction to my staff was, we're going to use it on as many patients that it's not contraindicated on, because I don't know where it's going to fit in. I didn't try to create a problem for a solution. I just was like, I believe in this. I want to see where it goes. And in the first quarter, and there's only 3 things, it's contraindicated just like a TENS unit, right? The 3 things that normal E-stim would be, totally different than that for other purposes. But so
what would those things be, just so everybody's not a mystery?
Pregnancy, known malignancy, and pacemaker.
Yep. Okay. Yeah. Fair enough.
So, I remember that. Thanks, Brian. You almost got me on the spot there. But at the end of the first quarter of just using it, we started seeing what I've now coined practice evangelists, where patients would leave and they would have 4 of their family members come back with them, or they would say, hey, 4 of my family members want to know if this would work for them based on the results they got. And I've been a PT for 20 years at the time. And I had pretty good aha skills, meaning, the first visit, you can get that aha factor by doing a little trick you learned, or just the way you talk to them about how you're going to get them better. But I was never able to scale that to my junior therapists. I was that practice owner that now I've seen over 200 practice owners across the country the past 5 years. I've had the privilege to work with very similar pain points. You have a hard time adding cash because they only want to go to the owner or the senior therapist for cash.
Yeah.
Well, in the first month, I had it was like a crazy, I think it was like a 73% increase in referrals in the in the first quarter. If I looked at quarter one of 2018 when I brought it on and quarter one of 2017, like something like 73% more referrals in that first quarter year from the previous year. I'm thinking,
and that's what I mean by, being a differentiator, having an item, having a service, having a product that's such a differentiator, you're going to draw that volume of new business. You're going to get that percentage of market share because you are the new kid on the block with something that really, really works. And so your experience is the same experience I hear from all my other PT owners that I say, trust me, you need a Neubie in your office. So that's awesome, Jason. You experience the same thing as everyone else. You also said something that was really relevant and I think really, really important. It could cost you thousands and thousands of dollars and a long time to become very highly skilled and trained in manual therapy. But talk a little bit about how your PTAs can apply this with the same degree of success as your DPTs. And talk a little bit about how bulletproof the training is and the knowledge is and the skill set for people to be, very proficient at applying the Neubie.
Yeah, the simple process is you do muscle tests, which everybody knows how to do. You do activations that Garrett's, Neufit method teaches if you're not proficient in muscle activation, as a precursor. And then you just map, like if it's a shoulder, you do what we call mapping in the region of the shoulder, and you find the two spots where the patient says, ouch, that's where the boo-boo hurts the most, more or less. That's as simple as it is. Where they feel it the most is where you put the pads. And then from a simplicity standpoint, it doesn't matter if you're a super skilled manual therapist, a brand new grad physical therapy assistant, you love doing exercise, you just do the movement part of whatever treatment you're going to do, which is why it's so simple. You don't have to change no matter how you practice physical therapy already, no matter what your clinical decision-making process is already based on your level of experience, training, and things like that. You just use it for the movement part of the therapy. And in my estimation, it's like a 10x multiplier is if you didn't do the movement part without the Neubie, if that makes sense.
Yeah. So if you're rehabbing that movement recovery without the Neubie, or you're using the Neubie is going to give you a 10x bump up in your expected outcomes. Is what
and I get the question all the time, how long do you have to have it? Well, however long you're going to be having the patient moving during your treatment, whatever movement, whether it's walking, whether it's functional, whether it's just Therex, put the Neubie on them during those processes. And there's also specialty protocols, which we know resets the autonomic nervous system, since we've since found out there's protocols underwater, different things like that. But the general gist of it is, you map, you find out where they say ouch the most when you map, you do the movement you were going to do anyway. And it's magic sauce, and that's how you can let a PTA or a new grad PT, those patients that only would ask for you. And let's say they're paying $150 for the hour for a cash-based service. They're now not only willing to go see that junior therapist, they're wanting to see them if they can get this treatment while they're doing the treatment.
Absolutely. So if I'm that therapist at home listening right now, and I'm like, yeah, Garrett, Jason, this sounds really great, but it just sounds like it's going to be more work for me, bigger schedule for me, busier for me. That's not the case. This is so okay. So if I have a PTA or another PT that's working with me in the clinic, how long is the training before they're proficient? And what is that training? Do they have to fly to Tampa? Do they have to fly somewhere? Is it web-based? I mean, how does that go?
Garrett, do you want to comment on the Neufit initial training? And then, we can talk about where the stuff I talk about fits in.
Yeah, absolutely. So we had been doing in-person trainings before COVID. Because of COVID, we moved them all online, and we've had such positive feedback that people like not having to travel, people like being able to access it at their own convenience. And so that's our primary training now is online. So the full version is our Neufit Level 1 certification, which includes a lot of introduction to these neurological concepts and principles, some of the manual techniques, including using the Neubie with the electric glove, which is a fun take on manual therapy, and then mapping and some of the core protocols or techniques with the Neubie. And so that's good for 25 CEUs towards physical therapy license renewal. And then Jason also has a quick start, and we have a version as well. If someone doesn't want to do that deeper dive, if they just want to like, hey, 80-20 principle, just give me what I need to get started and try it, we have a couple quick start options also online. And then, so occasionally people will still fly down to our clinic in Austin, to Jason's in Tampa. We now have a physical therapy clinic. We got 5 active PTs as well here in Austin. So both of those are options. Occasionally people will invest to have Jason or someone on our team, or someone fly up and do in-person trainings for them and their staff as well. So those are all options. But the majority of clinics, and now there's 250 to 300 practices that have devices, and certainly since COVID, a vast majority of them have done the online virtual training, and then practicing on each other. They've been able to get up and running, get proficient, and start getting those wow moments with their patients and getting those really, really good outcomes, and driving the referrals and increasing patient satisfaction, all those wonderful things.
Good. I was real quick. I was on a call with a bunch of neuro Neubie practitioners. I was invited to kind of listen in, and the host of the call introduced me as somebody who's really good at making complex concepts super simple. And I was like, was that just an underhanded insult, or what was that? But so when I kind of brought the Neubie into CEP, I was like, man, and Garrett's like, I want you to start teaching the courses as well. I'm like, 25 hours of neuroscience. And I, a year ago, didn't know what a Golgi tendon organ was, or I forgot, right? So I'm thinking there's no way I could regurgitate everything and reproduce all the knowledge Garrett has in his head. He, by the way, is a neuroscientist and an engineer. So I'm a physical therapist. So neither one of us is a good marketer based on definition, right? But True. So I developed my own version that turned into, hey, in my intro courses, how can you bring this into your PT practice? I actually showed some of Garrett's videos in that course. I gave patient success stories. I talked about the indications, contraindications, and we even use it as like a feeder intro course. If somebody's on the fence, like, I don't know how to really use this, I created a virtual course to say, hey, if you want to have no doubt of whether you should add the Neubie to your practice, that's the purpose of my intro course, right? My second course is just like a quick start guide. Like, so I wanted every physical therapist in the practice to not be afraid of touching the machine, turning it on. So I didn't reproduce any of the amazing stuff that Neufit and Garrett has produced. It's just more or less the practical, hey, before you get scared and don't want to try it, do this. And then you'll see why it has so much meaning and how easy it can be to add it to your practice. So if that summarizes kind of where, how we interact and how we work together and things like that.
All right. So I'm trying to think, if I'm at home and I'm listening, and I'm a PT, I have one office that's 1,800 square feet, or maybe I have 2 offices, maybe one's 2,000, another one's 1,500. 73% of all the private practices in the US are onesie twosies, 1 to 2 locations. And I'm thinking to myself, okay, so I need to do it. I need to change something, right? I need to make a change. Taxes are going up, inflation's getting high. People are wanting to get paid for working less. I've got all these increased challenges. You guys have done a really good job explaining the science and the research that went into it. You did a really good job of explaining the application and the ease of training and the ease of, putting this into my practice as another, practice technique. Explain to me now, as the practice owner, why this is heads and shoulders above any other option that could help offset. We're not talking clinical. Let's talk business. Let's talk business, finance, net revenue. We've already proved a point that this is extremely beneficial to every patient care experience, achieves optimum health with so many people. And we have such a huge track record. Just to put a nail in that a little bit more, Jason, what is the percentage of people who buy one Neubie who ultimately end up buying more than one?
Everybody. I did the stats about 2 years ago, and and I joke with people when they're at these conferences. I'm like, if you do this, because there's a 3-month trial period where it's like, hey, it's a big ticket item, potentially try for 3 months. We've done probably, I would say, Garrett, over 100 of those, if not way more than that now, of the 3-month trials. And I don't have any knowledge of anybody that ever turned one back in after 3 months. So either it just works, which we know it does. The training and the onboarding is super simple to get everybody using it, and you're starting to at least see ROI in those 3 months. And then every single 100% of those clinics have converted. And I already told you, you got a therapist and an engineer. So we don't know how to be salespeople or marketers whatsoever, but we believe in a product and we've seen it work over and over again. And that's why, and I tell people, just from a selfish reason, if somebody comes on board, they're not going to be the first one to want to turn it back in, because I don't want to not be able to say that anymore, for no other reason. But it does just work. So 3.2 machines, I'm sure it's more than that, based on the clinic. My clinic alone, and I always test things. I always use my practice in Tampa. I have 3 locations as kind of like a think tank, as a petri dish, as a test center, as a clinical trial center. If it doesn't work, I'm not going to talk about it. And if it doesn't work in the next 3 or 4 or 5 or 10 clinics I talk to about it, it doesn't matter if you're in rural upstate New York, doesn't matter if you're a cash-based practice in Seattle, doesn't matter if you're in Southern California, in the middle of the country, in Michigan or Ohio. You're in Coldwater, Ohio, in a town of 1,200 people. By the way, Jackie has 7 or 8 machines in that town. So a little shout out to Jackie Brewing.
That's awesome.
It's just worked. And I get more confident by telling people about it when I've seen it just be success after success after success. And it's just, for me, I don't know, that sign right there, I put it in like when I'm on a call or something, because I have to always think about what is my why. And it's really comes down to helping each other help others. And I remember in your early podcast, Brian, when I was listening to him, even before I was, before we became friends and colleagues and things like that, I remember you saying, PTs have to help other PTs, something along those lines. And for me, it's just about using technology to help each other help others, whether you're that startup that needs an instant differentiator so you can make it through that first year. I think your kind of thing is nobody's ever failed as a startup when you worked with them. Or if it's that other end of the bookshelf where it's a practice owner like myself, I'll be 50 years old next month. And I needed something to be able to scale my practice, to not be the 1 or 2 therapist practice, because eventually, I want to be able to retire and I want to have value for what I put my life savings, my blood, sweat, and tears. And I want my family to have a life after I retire with some value that I've produced. And that's the other end of it. And so that's kind of what it's all about for me. When I see a brand new practice say, hey, I have 3 therapists after 1 year, I'm like, well, that's not good enough. You need 40% cash. Or, it's a practice owner. We just met one at the last conference we were at, sole practitioner in a state where it's really tough with, accountable care organizations. And he's, thinking about getting his first Neubie because he wants to scale his practice so he has something to show for it to be able to retire. So, it's I've never come across a clinical product that has come close to any of that across, and especially almost exclusively across the board 100% of the time. And then there's other things like heart rate variability and PEMF and other things we could talk about on other podcasts that are.
There's other technologies out there for sure. And they all have their place and benefit, but I have to say the same thing. I've never seen anything that has such, great clinical results as well as practice, owner practice management results. And so, I'm just going to give you guys a quick story. I had a practice owner get the Neubie and put it in her practice, and you can use it and bill for it. I have a billing company. You can bill for it through insurance. And because it's a rehab protocol, neuromuscular rehab protocol, you can be applying that technique and protocol to your patient and be billing 97112, not 97114. So that's a big game changer just there in the financial side of things. The other side of it is you could also have it there for cash-based services. You can have people come in and just get Neubie treatments. And so I'll never forget this practice owner coming up to me at PPS, which is always like, end of October, beginning of November, just like it's coming up. And if you guys come, you have to go to our social. We'll all be there and you'll meet us all. We'll answer any questions and connect you to other people who are really using it, who are private practice just like you. And I think that has a lot of value. But what I was going to say was she came up to me with her P&L, pulled it out of her pocketbook and said, here's my cash-based column where the Neubie is. And year to date was like $101,000 or something like that. And I'm like, you have collected over the counter $101,000. She goes, Brian, that's just the cash. That's just the cash. That has nothing to do with how much we've built out on the insurance side of it. So I know a lot of you practice owners, yes, we need something that's clinically relevant, will achieve optimum health, give the best patient care experience and outcomes that we're looking for. Obviously, you can't go past go if you don't have that. But we've already hopefully solidified your confidence in that side of it for sure. And if not, we can put you in contact with a ton of PT owners after this podcast that you can talk to. But it has to also make good financial sense. It has to be a good business decision. I would be hard pressed to think of a practice owner that I turned on to the Neubie who actually bought one, who didn't buy a second one. I mean, like Jason, I would have a hard time thinking of somebody who did. And no one's going to buy two of something that's not working, right? if it's not what we're talking about. So I wanted to make that really, really clear. So we've gone through that, and that's a little bit of the economics of it for all of you guys. Let's talk a little bit about the advanced science and what's happening post-pandemically. I know you guys are now in professional teams. You're now in hospital centers. Maybe you guys could drop a couple of the professional teams that are now using the Neubie, maybe even some bigger institutions that are using it, because, my audience is, physical therapists in private practice. But I think they need to understand that this is going well beyond that at this point. So I'd love one of the two of you just to share a little bit of that validation. And then I'd like you guys to share a little bit of the advanced science and outcomes, because I know this has been getting a lot of attention on the research lines in terms of long COVID and several other things. I know one of my practice owners up in the Pacific Northwest has a waiting list of MS patients that come to see him because of the benefits these MS patients are getting that is just blowing them away without medication. So that I've had personal experience in. But let me kick it back to you guys. Could you please share a little bit about how far and why this has been branching out institutionally and professionally, and then talk a little bit about this advanced science and the research that's being done currently?
Yeah, I think Garrett could talk about most of the stuff he just asked. I can kind of talk briefly on long COVID when he's done.
Okay.
Yeah, absolutely. So in the sports world, sports medicine, there's been some really incredible applications there and some great outcomes. And the last two of the last three World Series champion teams, the Dodgers and the Nationals, are using it. 7 or 8 other Major League Baseball teams, 3 or 4 NFL teams, 1 or 2 each in the NBA and NHL so far. And then individual players, guys like Saquon Barkley, running back for the New York Giants. He did a video with us that part of why I mentioned is that all the practices that have a Neubie are able to use this in their marketing. And we have 7 or 8 others from really, big name athletes. But he talks about how when he had his ACL surgery a couple of years ago, at the 5-month mark, he was stalled. He was still stiff and weak. And he used the Neubie, and in his first session, he describes how he felt his quad turn back on for the first time since the surgery and how it changed the trajectory of his recovery. And objectively, he worked with Dr. Elatrosh out in Los Angeles, who works a lot of high-end athletes, and he's on par with James Andrews, that sort of thing. Right. And Saquon at the 5-month mark, so Elatrosh has this proprietary 50-point lower extremity functional score scaling system, and Saquon was 23 out of 50 at the 5-month mark. 2 months later, using the Neubie, he was up to 49. So it changed the trajectory of his recovery, made a big difference. And he talks about how he now uses it to get ahead of any issues, for maintenance, for muscle activation before games, and he uses it regularly in his routine. And of course, he's now the first or second leading rusher so far in this season. And so other great testimonials like that. And then across the board, the common thread of the nervous system weaves throughout sports medicine, post-op care, and then working with patients who have stroke, spinal cord injury, MS, or other neurodegenerative diseases. So we have some studies going on across the board there. In terms of hospital systems also, we're doing a study and have a case series that just got accepted for publication, working with Centura Health System in Colorado, and fairly large hospital system out there. So we're looking at MS patients and measuring their functional recovery. So we're looking at improvements in timed up and go testing and time 25 walk tests, looking at changes in their disability scaling scores and things like that. And that case series just got accepted, will be out at some point in the next several months. That's one of the hospital systems there. We have another one going, a pilot here with Baylor Scott and White in Texas, looking at functional recovery for stroke patients. And then Post-operatively, we're working with a big orthopedic group in Ohio measuring outcomes for post-op athletes after ACL reconstruction and an older population after total knee, looking at the number of therapy visits that they need, the time it takes to reach their functional milestones, all these things there. And the pilot data there is very impressive, certainly showing that working with the Neubie is helping, just like we're seeing at Health in Motion in Wisconsin, a practice that you both know well.
Oh, yeah.
So they use FOTO, the Focus on Therapeutic Outcomes database, and they've compared and we see some cool stats where when they added the Neubie into their first practice, their the functional improvement scores increased, patient satisfaction increased. They saw statistically some really meaningful things there. And then just two other things study-wise. I know we're kind of going across a whole broad range of things here, but there's a lot going on, and it's all, at least to me, fascinating and exciting, and hopefully to you as well. But
Definitely it is.
We have another study with the HODS group, hands-on diagnostics.
Yep.
So they train physical therapists in musculoskeletal ultrasound, and I think I said ultraskeletal at first, and EMG and nerve conduction testing, so electrodiagnostics. And so we're working with them. This is probably the most ambitious in terms of the number of subjects, but multiple hundreds of patients with polyneuropathy, and so we're using those electrodiagnostic techniques to measure the changes in nerve regeneration, nerve growth, nerve function, and we're seeing some really cool outcomes there in the pilot data. We're seeing nerve regeneration, seeing collateral sprouting even in older patients in their 70s and 80s, when most of the time it's been written off that they could even make any progress at all. So seeing progress there. And then down in Tampa at the University of South Florida, they have done 2 studies looking at the effect of the Neubie with no external load compared to using 70 to 75% of 1 rep max, so more traditional resistance training. And the first study looked at the acute response. They saw, looking with ultrasound at the movement of fluids from the extracellular space to the intracellular space, or muscle cell swelling is one of the precursors of hypertrophy. They saw that was similar. And then over a full training cycle, it was either 6 or 8 week training cycle, they saw similar muscle growth using the Neubie with no external load versus using traditional resistance exercise. They both caused very similar, statistically significant and very similar amounts of muscle growth there. So that the use case is some of that later stage rehab, early stage return to play, when you want to get muscle load, but you might be a risk of re-injury if you're going to load someone up really heavy, or these cash-based fitness services that you guys are talking about, or someone who doesn't have the mobility or it wouldn't be safe, or they can't access resistance training. So there's opportunities to do that. So a lot of really cool things happening across the board on the research front. And we have a full-time PhD neuroscientist now who runs our research program and is supporting research partners, doing some ourselves, various aspects of that.
That's awesome. Yeah, that's way more than I expected. I mean, I knew some of that, but I needed to ask the question. And I think the public, I hope you guys listening are really appreciative of that, because like Garrett said, it's not just their research, it's external and internal research. Jason, talk a little bit about long COVID. I think we kind of just stumbled on this. I mean, maybe I'm wrong, but it's having some significant benefits there too, right?
Yeah, we kind of figured out almost by accident between the studies I've been doing, clinical trials, and what Neufit and their other affiliates have been doing, that early on we started seeing a significant improvement in a patient's autonomic nervous system function through tracking heart rate variability. And, I don't think we have enough time to go into the intricacies of that, but just know that if heart rate variability is higher, they're in more of an improved state of their nervous system, a kind of a rest and digest, kind of recovery state. And so hearing about long COVID, there's studies out there through the CDC and other groups that say about between 15 and 30% of anybody who's had COVID is going to be suffering with long COVID or is suffering with long COVID. So that's millions and millions of people: brain fog, depression, inability to sleep, weakness, balance problems, all these almost like autoimmune type, systems. And we've noticed that with patients who have had COVID and have long COVID, they have a very depressed autonomic nervous system. So using heart rate variability and very specific forms of it, where you can kind of get a snapshot of that patient, when they come in for a treatment session, we can give them probably the very first baseline they've ever heard of as far as why are they feeling like they're feeling, instead of just having sometimes what we call a garbage can diagnosis, like fibromyalgia or used to be in things like that, where it's diagnosed and adios. We're saying, okay, we do see you are in sympathetic dominance. We do see your neurohumoral control, hormonal control is affected. We do see all these things through, taking a measurement through using an ECG on the wrist. And then one of the protocols with the Neubie, and we know PEMF, pulse electromagnetic field, also helps. Just using this vagus nerve reset technology to kind of, stimulate the vagus nerve. We know that helps improve people, brings them out of sympathetic dominance into parasympathetic. So we're in the final phases of launching a long COVID protocol using heart rate variability, utilizing the Neubie master reset protocol. And we feel like this is, potentially, one of the biggest things coming out, because these patients don't have anywhere to go. And a lot of them are on disability, which is one of the reasons the government gets involved, because it's going to be a huge disability. People are committing suicide because they used to be able to work and now they don't know why they can't work anymore. So it's huge. So it's, again, helping each other help others. And that's kind of, what it's all about. So there's a lot more, about that if they want to reach out to me.
Yeah. And you said it earlier, I've always been a big fan of it's PTs helping PTs, right? I mean, this is what it's all about. We've got to fight the good fight. And, there's only two reasons why we go to PT school in my book. And you guys have heard me say this on multiple episodes. One, to do all that I can in each and every session to help somebody achieve optimum health to my maximum capabilities. And number two, to help as many people as possible throughout my career, throughout my week, my month, my year. I'm interested in helping as many people in my community achieve the best functional outcomes for their health, not just their knee or their ankle, but their overwhelming health. And this really was a game changer for me, so much so that I bought one myself. Yes, Garrett did not give me one, everybody. You would think, but that did not happen.
And you never asked for free therapy either. Cash-based service.
That's the joke of it.
Every time I treated you for therapy.
even if he offered it to me for free, I wouldn't take it. I'm just not that guy. That's just not my nature. I like a discount every here and there, but as does anybody. But hey, I bought one myself because it was that valuable to me. And I'll leave everybody with this. I know we've gone a little longer, but I thought this was really relevant and good messaging. And you have really two high-end experts here that you can tap into and listen to. I just want to say, whenever you find yourself in a situation where you're able to give more in value than you ever expect in return, I think you're living a good day. I think you've lived a good day. My mantra here is start each and every day expecting to do well. I hope you all have enjoyed this podcast. You've enjoyed this YouTube. You've gotten something from it, this video content. I want to extend to all of you this idea that the more educated you are in building a learning management system within your practice so that you can educate and enhance both personally and professionally those around you, and complement that with the highest relevant clinical technology and application of that technology with those people, well, now you're helping the body and the soul of your practice. And that's the way I see it. So I want you all to succeed. I want everyone to flourish and prosper. Obviously, that's all we care about, is being a physical therapy private practice owner advocate. And I hope you're getting that from this episode and all the episodes, I hope. So if I can help you any further, all the contact information for Jason and for Garrett is below in this podcast and on our YouTube channel. Obviously, go to our website, reach out to me. I would be happy to do a practice assessment. Let's know where you are, whether you need a billing assessment, credentialing, practice assessment. And obviously, Jason can also help you with advancing and scaling expansion into a high-tech clinical setting and environment with all the high technology applications. But you just, in my opinion, can't compete with a clinic down the road from you that's using the Neubie when you're not. You just need to learn more about it. It's in the absence of information, you will always hesitate in doing what you need to do. Don't be one of those people. Pound your fist on the table. Know it's time for a change. Make that change and experience the results for you and your patients and your staff after doing so. Be that leader that you know you are. That requires you making a commitment and actually getting outside your comfort zone. So that's it for this week. Like I said, everybody, thank you so much for listening. I'm very honored and blessed that you listen to this podcast. I know you can listen to all kinds of things, but you're here with us. So I hope this was helpful. Send it, share it, like it, do the best you can to help us get this message out to other people, because we're really trying to help as many as possible. Jason, thank you so much for being here. Garrett, equally, thank you so very much for being here. And that's it for us this week, everybody. As always, start each and every morning expecting to do well. Bye, everybody.
Thank you.
Thank you.